I am joined now by David Jackson, White House correspondent at USA Today, and Dr. Ugo Iroku, physician and public health expert. Lots to talk about. I'm just going to get right to it. Dr. Ugo, President Trump was taken, or is being taken, to Walter Reed Medical Center in what White House aides said was a precautionary move, but we also recently learned that he's taken an experimental antibody cocktail. That's what some are reporting. What can we interpret from these moves with the knowledge that he's already experiencing mild symptoms and he's in that high-risk age group?
That's right. Thank you for the question. You're right. President Trump is in a high-risk group. That's based on a number of factors involving his demographics. He's age 74, which places him as having a mortality risk at about 1 in 12. He's a male, and males tend to have twice the mortality rate than females. And he's also at 6'3", weighing about 244 pounds. He falls in the obese category, which does increase the likelihood of hospitalizations by threefold, increases the risk of ICU admission by 75%, and increases the mortality rate by 50%. And so, given that he is in a high risk category, it seems like they're being very cautious. The word from the White House is that he's experiencing mild symptoms. The typical American would not need to be hospitalized at this stage, would typically be under self-isolation at home, watching their temperature and for shortness of breath, and only if they experience severe shortness of breath would they go to the emergency room. But given his status as a commander-in-chief, it seems they're being especially cautious. When it comes to this new treatment that he's being given, Regeneron's polyclonal antibody, it's similar to the convalescent plasma that we've talked about, except it's scientifically engineered to attack the virus at multiple points at its spike protein and another protein to increase the likelihood of a decreased viral load in the patient and decreased hospital stay.